Hello, good morning.
Good morning.
Now, what is saying?
Apomuboko.
Edanyami asimpacho down where the Ghana for.
Okay. Me de Margaret Yankson. Me me marketing officer at Banor Memorial Hospital. In other words, you can say New York or customer for Banor Memorial Hospital. And then me.
All right. Your papa being so papa you where the Ghana for.
Okay, so my name is Seth Ephraim Tetekwe.
Okay.
I'm the country director, stroke project director for Medical Ministry International.
Okay.
Yeah.
And so let's start from you. Medical, is it what?
Ministry. MMI, Medical
okay,
Ministry
International.
Yeah.
What are you all about?
Okay, so Medical Ministry International is a faith-based organization, non-profit making organization that sees to the needs of the underserved in the community medically. Yes, so we go about visiting facilities. We can partner them to have projects that can be surgical projects or mobile clinics. So that is all that we do here in Ghana.
All right, so this time you're tackling fibroids.
Yes.
Why?
Okay, so it's a yearly thing Medical Ministry would do. So normally we do the needs assessment from the hospitals. So when the hospital is able to tell us that we had more people, coming in with fibroids, then we will have to do a quick introduction to our partners in Canada that this is their needs. So then we will come and then have the projects in Ghana. So that's what we do.
All right. So Banor Hospital is partnering Medical Ministries International. Why?
Okay. So when we mention Banor Memorial Hospital, we make reference to Dr. Matthew Anum Banor of blessed memory. So it was his wish, or during his time, his service to the people was community service. Community service. That was his foundation for putting up Banor Memorial Hospital. So his last wish before he left us in 2005 was, when I am gone, continue with community service. So Banor, we've always, based everything we do, every service we provide to you out there is just based on community service.
Okay. So this time you're tackling fibroids with Medical Ministries International.
We're tackling fibroids, ovarian cysts, and a hysterectomy, that is the extraction of the womb. Okay. The twist to it this time is we're providing fertility clinical services free of charge.
Okay. Enti mami ntire mu kakra ebusuafo mpanimfo a anyone edin komo anopai eye mami a ofi Banor Memorial Hospital and ye papa nso so a ofi Medical Ministries International na afi ni awafa to won ho so a wo ye ene se obekọ emma emmoa na oka se etoda woni hospital bi kabom eye adwuma na ya na woni hospital no edin komo ehu yare a nipa bebre na edeba na this time no oka fibroids ye mami enso ka se ovarian cyst any hysterectomy ni nyina ye ade a omo na nanka ye hwe ni mu se nka mbetumi a kire ye fa ne maako a I don't know, you are not medical people, but are you able to speak about fibroids, ovarian cyst, or the hysterectomy, that's the extraction of the uterus? Are you able to speak about that?
Since I'm not a medical person, I wouldn't love to.
Okay, and yeah, share ni mu say yen sabeka Dr. Bako ewa homa so na ye no ene ready nkomo Dr. Justice Ray ye shiana or ye hwe yen sakana ye ne no ebedi nkomo. Pastor, you work with Banor Hospital. You must have a fair idea. Let's talk about fibroids, the prevalence of it. Now, in my research, correct me if I am wrong, because sometimes research in the Ghana have made share 1 year a 10-year fibroid partner. You say and crying for my and number one. Let's put it out there. Me, I checked and crying for my every while. I'm gonna for my I can for my and sana 1 year chat to cry 1 year a war. Northern sector. Do you know anything about this?
Okay, I am not privy to this information. However, I can say the prevalence rate is high in the black race than the white race.
Okay.
The black race, because it differs from our foods are mainly built on carbs, the carbohydrates, the sugars. Into we are susceptible to the fibroids than abrofono.
Now, what is that? Say Ghana ha when you were to do Bogatanga, wa northern region, region, and then ya fibroids.
Because their foods are lean.
Lean.
Yes.
And you are no
they are lean.
Yeah. Okay. Yeah. And to Dr. Justice Ray, so Doctor, what have you been watching? Me bacho emi de pass anope wa ba be kan ho Max TV so na Medical Ministries International ne Banor Hospital akambo mu e de nsem de bi e ba ema asueye na emomu ade a afi wo hwe no e fibroid any ovarian cyst any hysterectomy na yemfa ne mako doctor e kan fibroid a Ghana ha ti sen kosro e ba form ejina wada ma ne ani hu nkomo kakra.
Well, even things with the now. Fibroid, Tanya, you want to see no, and now recent tools that the investigation and you know, these are more numbers than before. But on the average, you know, you have a population of before year, you back there 10 BRC one more, mobile 8. Fibroid maybe. Fibroid maybe. And say any mom say hard drink. If you bet me your fibroid, your whole life will cry only. Obviously, being your fibroid, it's where I be war. Now, would you anymore? Bet me a hand, popping time will be your intervention for it.
Now, doctor, I no Ghana ha. Yenim say a before no, before no. Yana fibroids ni tan high and pa. Na Ghana ha, wo hwe regions na. He papa na obetumi aka say e matanya fibroids pa.
I'm not going to mean Gina Federation Kano on a point to say this particular region there was high occurrence. But generally in black people, almost that's about 80% of women we see. That was fibroid MUB. Fibroid Omahodro. And say it was Mbani will be. But me to mean just a region way, most of the occurrence.
Okay. Now, Doctor, fibroid eba or baby swa. Brony friend is symptoms, signs and symptoms. Ediana, a bed daddy or bani who a man who say a beer or yenya fibroid.
The commonest symptom are pushing of local hospitals. I one, if you are, who say, that is Naya, the one no, and start say, Yakasi. The Onwa or banning himself on him, but Naya say that if in Fuma say aircon, I start say Yakasi, and that's what in Sapoba, but to say Bibi Ding, a war, Naya, the one. If you also move one star, a year or no, I come on here, and yet normal. Nti womote yawo pa your time omo bu omo nsa na omo ewie kura no ebenum so bleed bebree nti obebu ne nsa mbuja eba no 2 months na take a long time so answer to track ebe okura time means no so obebu ne nsa no na wa start bleeding where you one of the commonest symptoms that a pushing go for hospital but ebi so ne say edu ha oba no ontumi mfa yefunu and on stress fibroid bia be ma wontumi mfa yefunu see I want to make a disclaimer kakra wo ho ebi mi say obetumi aban so odwunso bebree dwunso de no a enche na okwa dwunso be because fibroid and the pressure to ne blood na ewo awodie nanim no ebi kwa to me cause this is yaw and as constipation see where are some of the signs of human?
Maybe apart from near what kind of banankasa, a behun society on with the muno. Quambe subium, any a faso, and who saw bar, especially so ba hospital a kwan ben so ne fa e ma ne bi si wo musuro mi koyi ye be ye mbibi to allay their fears and for the purposes of education kwan ben so na nipa ne ba hospital a mo fa so hunu say nipa no fibroid and say oni fibroid
into nipa ne the complaints we na the back hospital the doctor ne be din kan ahwe no physical examination we still complaints ni heavy no or the nsabe kan wa examine no the ordinance can lower abdomen, that's why you have to one not high suspicion. The IPA mass be an ABB any or no more. Over request is a young boy can any of the imaging investigation commonly ultrasound scan. Now ultrasound scan no be share. No one who say, oh, why would you not be a woman who experiences an mano and not to say it be before. The ban say a fibroid idea, one a doctor and a bachelor fibroid near any most especially obey explaining near between your course still and say is how I dream of so a doctor and a cancer. Okay, before first idea, then we'll address it as it is.
All right. Now, doctor, say you say fibroid bronisi remedy again na obani ebe to me ayama na sa fibroid na free ne so.
And say, Sunny American fibroid who do be brave. Na near etadiano, near air cost bleeding be brave, na nimpano or ya anemic, that is Nimbuja so air cofum a hano. And also near cost nimpana a young it may affect in a daily life. And also say, one in Panama on for your phone. Into your money be beside ma. Now, doctor never planning a plan over for so abroad.
Okay.
So you're too bad with these situations here, Makia. Now, mostly, a bit me a man drive a bois, say, Mujana Bebosro. The woman drive a ma a yellow narco. The fertility doctors or Bishop Panya of it to me a boama means sign papa. But me na fairly dear. There's never go see na why yet a fairly dear. Never consider the surgery intervention, surgical intervention.
Okay. Doctor, fibroid surgical intervention, because I'm confused rupa, intina bebre, edi share shifino. We are medical doctor, young educating Ghana for FMX TV and pay. Se no, ya say emwa bebre aba, enti any inkomo.
Answer, Dr. Diani Obeka, fibroid operation once no. Let's just say you consider all the risk and benefits. Because on the one or your ban on a bed discuss it. Say, or can't fibroid operation once a month, not just a 1 year fibroid operation, more, will be to your problem.
Okay.
In the matter say, a new.
Okay.
The yes, say, yeah, will be a how will be at on for your fibroid operation. Because and you'll be at a needed or quiet operation. The just say you say the risk associated with young yeno, a bit me a hawaii.
Okay.
If you a bit me a prevent this all bell. If you won't go will form the baby, would you more crowd to make quiet? If you were a year will come I'm sure it will move cry won't go for so acostro. If you know what I want to mean you more partners in here, said Nukuno in here.
Okay.
Because of fibroid weight. Or initiate a year or if you are the baby or bleeding into affect some way of life. They are considered some way and then you choose to say young uses surgical intervention and one in battle.
Okay, doctor, me wo for ni bi wo screen so wadama say ube to me any young afemu kakra ni eda so wadama de en yenim say awodie no e no natural had uterine fibroids but tretremu ye kakra.
Oh, okay. Membrane screens is the idea, but for me, I will come. I think imagine extra fibroids different way. I would hear home.
Okay.
Into your far would say pay, obian in pay about maybe about pay. Fibroid is roughly that size. Now, you would know itchy. You would know Muslim mankasa a form I would know. Now, what I would know. Pneumonia baby, so or by a fire funeral, a colano family. na saa baby miɛnsa yi a mabɔ yi nyinaa fibroid tumi ani wɔ hɔ awodeɛ no akyi no fibroid ne taa ɛba hɔ a ɛyɛ a ɛntaa ha adwene bebree ebi a ɛyaw bi na ɛde bɛma wo na ɛwɔ nea ɛba awodeɛ no akyi nanso ɛtan nipa no yam sɛ metwii no wɔ nti asɛ papa fibroid no ɛto a awodeɛ no ho nti bi wɔ sɛ ɔte sɛ biribi ɛnenam ne yam ɛndɛ adeɛ no wɔ left tena ne ɛhuri kɔ right ɛbɛtumi ayɛ saa kind of fibroid na yɛfrɛ no pedunculated fibroid ne bi na ɛwɔ awodeɛ no ankasa muscle no mu ɛno nso fibroid bɛtumi anyi wɔ in different size any different sizes and mostly causes a lot of pain. If not a crime, you want to say, because most often fibers time be ember, but start to say amount issues there it can cause a lot of pain. Now what I would mean near friend sub mucosa no and baby uncle Bob the star in Bojani if you know when a fiber be a tiny into anonymous mostly after environmental fertility because baby are fertilized egg look out for them on Casano fibroid is a order. And see we need types no there are sometimes even fibroid will service no ano and service no ST Emma Bema Homes won't name cause pregnancy. These are the types of fibroids are
okay. Doctor, yeah, that's CP. Now, as I never buy 1 year studio, Hano, idea back one, almost some boss so may normal menu, and person come once tiawa, na ye bow on so, almost can ovarian cyst, any hysterectomy. Maybe I know any when you know, as tiawa, nagana for 1 tias.
Ovarian cyst, my dear, means some baby here can only but answer Dr. Bebos so ovarian cyst. Not just say we ovary no every month be obviously no back when you fact back what be that is left and right. Every month be no ovary release nkosia, we move back on releasing nkosia. Our say sa system be a form na a type na nkosia na a free a muba. Into your can ovarian cyst the chart na dia. Like I said, time problem. Into what then will be so doctor will say, oh, a simple cyst and as be a complex. Now doctor naturally oh we a problem. But say ovarian cyst a year test there to the extent say to me cause the ovary na manantani na imboja supply a co ovary no hono a reduce ya and a problem.
Okay.
And to me cause severe pain and to say yeah they also intent yet to one among. Hysterectomy na work can here idea yedema operation. That is a woman award no inara. Sometimes fibroid may be to me anyone would to the extent to say you cry if you are would on a normal shape, the normal function and saying back. And also said the chances of fibroid in the air and other babies are no a high. Into doctors, nobody discusses oh, Sadia Yengi, I would in a hanging a no hysterectomy.
Now, Doctor, I mean, I bring doctors bet me I had that decision because for a baby no, without the womb or uterus, conception cannot take place. And at what time? And now, Doctor, for Beduni said, I was say to me, you are now, dear.
Time. Most often, and bar woman will pain.
Okay.
The entire woman discuss it hysterectomy as because the economy aquala elocapoda any. And most often so fibroid in about around when a woman is in the reproductive age. And say, just say, or baby, one way the enemy say you ever consider the risk, benefits, and sana.
Okay.
You have no call credit.
Oh, too bad. Okay, I think the education has gone down very well. The reason I was speaking to doctor a lot, na ama education ne ko ansa na mmoa na nipa because usu be boa me. Ade a usu ba be boa me nti ase. How can I even come to you? And so until na me bo no for the purposes of education because Ghana for bebre na ate but yen share there nim ho asem. Nti emra wo ho but medical ministries international. Nia doctor ka fibroid say ovarian cyst any sa or sister fibroid ne fa wo de ni nyina e toda depending on the risk factors and risk benefit to say there no kan no they might do a hysterectomy. How do you come in?
Okay, so I come in with the doctors. So we'll have a pre-screening in the consulting room, have a pre-screening. You'll be examined to physically and then through the scan. Yeah, so when it has affected the uterus, the doctor is going to tell you that this will be impossible for myomectomy.
Okay.
So we would love to do hysterectomy. If you agree, we'll just have to sign. If you do not agree, then they will take the next option.
Myomectomy ni en what I said no you be fibroid no na ye ja we no. Hysterectomy na say ye awude ni nyina say na be
uterus. Yeah, that's right.
Okay. Yamra Banor nkomo aye die nyina mo se mu ni medical ministries international kan bom na mo ye Banor die na mo be you see service to the people is that the core of your operation. So what will you be doing?
Okay, so from 2nd December to 14th December, and a BSR project, you be share say ankasa. Team na ebe boa bano na ye di dwumadi ankasa no. They arrive in the country on the 30th. That is Saturday ebe. On the 1st of December.
Yeah, madam, kraboduum kakrama me team no omo ye team ben.
Okay.
Chire mu ye.
So we have a team led by Dr. Nicole Williams. She is the board certified obstetrician and gynecologist, and she's the lead team for Medical Ministry International. Omo be di fibroid and hono ejumedi in you. And on any team no so so in the team we have anesthetists. Omo be analyze it nipa na yede ne beto pono no so ansa na yede nsa aka no. We have a fertility doctor in there, and then we have the assistant, the surgical assistants also in there. And you know, omoba on the 30th na dechi 1st December no, you be pre-screening. Pre-screening, you know, say, ansa na omodi omonsa be count no, you be per se we be some labs and scans. You per se you share blood group. You per se you share with sickling. You per se you share your full blood count. Na you say so your pelvic scan. You say your ECG, you be share your heart rate. Ne ade inti saa ade ubeye saa labs we ansana ye be started project on the 2nd. Inti ye no sesia no registration is open. Ene ya be ne wo kasa we ya obetumi ato ame wo hospital ho abetro wodin ya ma wa ye labs no ube keep saa document no Sunday from 2 p.m. ene ye be start say ye share amount for ye screening amount for. But even before then come and do your labs.
The earlier the better.
Yes, because Sunday no a hobeye deja.
Gidi.
A hobeye deja.
Okay.
We expect everybody to be there. What was how bra fertility consultation also so no. Omo sebi omo worry afidi etri omo wo hwe se nyame bedum weba. Ye bo ho pae bra na me doctors yi enhwe ye ma wo entity ye ma wa kwankyere afi be soon ye be kwa afi from I mean a year from today you will come back and present your baby to your doctors.
That is some good news for some woman watching Max TV this morning.
Yeah, that's right.
Obi bebusa wo se memra me hu ntina na me doctor ye no doctor keka nia doctor kan ya te me hu o bi kura obi wo ha ya ka kire no wakọ hospital be aka kire so fibroids but e bi asika o duka ko surgery ni ade no ntina oda so ete ho a onko ba bia no wo se memra me ba e free ana.
Okay, so would you like to talk about that?
Yeah. And you know, well, labs now obey no. It is outside of surgical fees no. surgery, fibroid surgery na nkasa no. Ye kan ye pa. Sanka wokoya, you won't pay anything less than 15,000 cedis. This 15,000 cedis no. Banor Hospital, ye yini hine free ho.
Eh?
15,000. 15,000
I was out here, to take some damage to you. Hey!
Me science is subium.
What's it?
Fibroid surgeries. So wo kwa koye wo hospital bia, you won't pay anything less than 15,000 Ghana cedis. Under normal circumstances.
150 million.
Yes.
You.
Banor Hospital say saka no trouble.
Tesa oka. Oh, not be
Banor Hospital say saka no trouble. Yeah,
Mo faka no.
Subsidized. Yeah, for procedure no eka. Wo dia obeya ni sa documentation ni screening.
Enu nkwa na abetua.
Procedure nankasa professional fees nanka obetua. Yeah, fa.
Wow.
So all you are paying is just the base.
Ola ba be ye any normal kitikiti bi a kan na.
That is a subsidized. So yeah, they post on it to screen.
On my Sunday to subio.
Subsidized, discounted surgeries. It is virtually nothing.
Wow. Let's come to you.
Yes, ma'am.
Do you confirm what she's saying? Do you confirm it?
Yes. So when I visited them, I wanted us to partner. It's a private hospital. Yes, it's a private place, and I know normally the private ones will charge higher. Yeah, so I was scared. So we had to introduce CRS. Yes. So that it will be as they trying to help the community. Yes. So I mentioned something to them, and they had to think about it. And then they came back to tell me, okay, we'll accept it, even though we don't take that. So it came so low that I cannot even imagine.
Wow.
Yes, so low that I cannot even imagine.
And Abusia, Potoka Papa can I will say Medical Ministries International, Banor for no, Omobo, Nyomoji, Nomsie, Adaruma, ye asomo mino, any ma. Na mubo de ye ntumi nti omo keka omo tiribo mu ana Banor for se wonim bibi ya nkasa no ye no ye sumo ma ne dada nti ye ne mu beka bom na ne ye yi afri ho nti eno na da ho no hope for fibroid relief transform your life ye se ni da so wo ho mo fibroid ye yi mu afisa ya ni nyina mu relief no osisisan wabrabo Banor Memorial Hospital in collaboration with Medical Ministries International is offering surgery for fibroids, ovarian cysts, and hysterectomy at a discounted rate. 2nd to 14th December 2024. Book your appointment now. Yeah, atadribi and nipa bebrati den enti mo Banor Hospital. Children baby amowo na for information na ye hia nyina minim say producer Daruma we ka see me phone lines na enkofo mfre ye ndia but then if na ye hwehwe wa ebehu
nti Banor Memorial Hospital ye wala tabi okoshi.
Okay.
Ye ben Radio Gold enye ira kwan.
Okay.
So wo fika na shi ena eba we ni tre mamprobi wudu Radio Gold junction hona bisa obia ye betro. It's from mamprobi na oba the same thing.
Wow.
Ufri Kolebu Mortuary Road, Efa Bishop Bowers Quine also Eba, Wudu Radio Gold traffic light and also Ubisa Biara Obecho.
Wow, more numbers to be up as Odi to Jana.
Okay, so your telephone numbers 03
03
02
02
307
307
865
865
0302
0302
307
307
865
865
if you are 050
050
139
139
69
69
08.
08.
Yes.
And about so account 024
0246
okay
046 716.
okay And now I'm a good screen and you know fat tron is see and I say save. So I'm curious.
Yeah.
What would the medical ministry international gain from all this?
Okay, so as I said, Medical Ministry International is a faith-based, not only surgeries, but we do other things.
Okay.
Okay, so it's something we do globally, not only in Ghana. We have Medical Ministry International in over 30 countries.
Okay.
Yeah, so it's something that we do yearly. Yes, so even next year we have about 6 projects.
Wow.
Yes, so it's a routine thing we do yearly.
So for those watching Max TV this morning,
Yeah.
you have a message for them?
Yes, okay. So normally, when people hear that a team is coming from the US, from Canada, from UK to do surgeries, what they think is that they are students who are coming to practice.
That's
yes.
In fact, the past so I can't start them and maybe team be on mobile. We so medical students are a work Canada near the mobile say fire guinea pig.
Yes.
Now as money and say you are, but then who can send you to Cressa?
Yes, so with Medical Ministry International, before any doctor comes in to serve, we go through the necessary process. We go through the Medical and Dental Council. They will have to scrutinize their documents to see that they are experienced people. So as I'm talking to you, they are what we call it? Their document is ready.
Okay.
Yes, which means they can practice. So that is their license.
Yes.
Yeah, their temporal license.
They need permission from the Ghana Medical Board
before they can.
They can. Yeah.
Yes. Other than that, they wouldn't be allowed to
okay.
Do
Into my minchire muna Ghana for ntiase. Or say na some all can say. Ye wadwene bi say 1 year free amanone eba krom ha ebe ye operations ahodo no. Ya na we students a wonu ba bia na ye de be before 7 preduasa. Ye ni sekenti na ye no mo de ba practice or say entisa na one eba no nkofo bia Ghana Medical Association agi won atum if you say we nkofo we experience pa na me say Mami Yankson who can be say lead no or your obstetrician aside gynecologist we practicing for over 20 years bibi say that kind me
Yes.
na just say nye student bi e na oba e de body abedi agora be sua bibi when you be a why adwuma no obi gina homa ne so nti yemfa no e bia no question bi e ma mo hello good morning. Hello. Hello, good morning.
Hey.
Mami, Pacha, what you mean? Okay. So, me Pacha, what you mean?
Hello.
Mami, Pacha, you are live on Max TV. Me and you. Okay. So, I'm struggling to hear her. And I believe our audience are also struggling here. Enti, Mami, any assembly na ukache Ghana for anopay. Papa na semwa waka no ehu hia pa. Enti na ya. When you come here, ask, is there something else you want to say? Maybe you want to say something I didn't ask. But is there something you want to say? Amen Musa.
Okay. Enti no, nyame pe se me ka etre ya manfo na se nyame pe se be tire mu say doctors na omo ba no. Omo de omo nan ahye wo mpaboam. Omo hye wo mpaboa. Nti wo ba na sa how bi wo ho a outside of the fibroids na any omo ndi nkomo. Do not inhibit any information
Ghana for doctors muka home Ghana for doctors na nurses. Kona ukasa be yeah. Here betiantia. Nti ya say doctor patient relationship it's sort of strict.
We no
In Ghana ha no. But you see broni ndi obeti nti kan wasem nyina.
We no say wunti e na omo ba. As at the time, me bra yeba hey, they actually screenshotted their time of arrival in the country.
Wow.
Until they are in communication, they are very, very eager to come down and meet you.
Okay.
Until to say they are a faith-based ministry. Omoni obe bompaye, umfa ukra emanyamia. Omoni obe fem. You will give your life to Christ. They will evangelize with you. They would, just say. They feel you. They feel you.
I want us to talk about something a little faith-based. And you spoke about what do life in Manyame and Christ and all of that. Are Muslims invited? Are traditional obi o sebe ya na nanu abosomfo oni o se bosom na obesom ebinom ye muslimifo ene ade obi abetumi ababia na
Patrol, Banor Hospital, we are not biased.
you are not biased
Yeah, sure we are.
we do like be ma Christo no obi beka say ya na Christofo nko ana
We are not biased.
okay
Yeah, sure be every pocket enters the hospital. Yes.
obi ara ho
Obi
aba ho bi o say o ma say Christo okay all right so our time is up. It's a mamu location ni biom anytime now and your last words before we
okay. So all that I would say is that the fertility doctor is coming for only 1 week.
1 week.
So this first week, if you have a problem with conceiving, please try and be there. Consulting is free. She's going to see you. It's free.
Enti papa na se mo kan se nia oba ama woni asebe wo pa wo no o se na watwe ba ko pe no obedi wo Ghana wo so wo san ko nchi Canada. Enti bomodia se enne yiara sebe be ma na about na oni Banor Hospital for dinsa wo so aye registration no oba wotumi ahwe obi e ba cho
Patrol fertility clinic enye ma pe ye be hwe mema so
ampa o
yes because a couple yes
enti yesi fa nkunu ka ho bra ba ma wo fa ya na ye de awo na ko se ma ne nko a
Patrol
se yesi mema no so nkoye yate
enye ma ne pe mema no so emra
Mr. and Mrs. For
yes
okay madam
okay. Banor Hospital, it's a 24-hour facility. Okay. So at any time of the day, you can walk in and then make your inquiries, do your registration. Like I said, we are located at Slated, close to Radio Gold. What do you do? Radio Gold when be at Banor Hospital will be a veteran.
Yeah, Mami Margaret Youngson, eh?
Yes.
Thank you so much.
Thank you.
Banor Hospital for Ojinamu Kasama won. Ban marketing sani etie no no anso so na hwe eyema won ye da CP ya no pay ora tete kwashi tete kwe I beg your pardon
yes
ora tete kwe nso so country director for Medical Ministries International oni abedin komo ye ensem de na aba say nti sa wotina ho na wankeka ho a wo de kwa na kohwe me ne wo a enka me hu science ni bi kura maye oba yi a yesi from 35 wo no you are at risk me ka meko ni ahwe me ni bia ani abrewa ne be se hule se mi wo bi nso a na ne yapɛ ho emuaye amame nti enyina na mmoye to yesi already gold in chen wa numbers no e go screen ani no afa na wa frɛ kama kama ebusuafo ye da mo CPS